Properly moving a patient from where they were found and then to the ambulance needs to be accomplished on most EMS calls. In most cases, this is done slowly and carefully. In some serious patients, the lifts may need to be done very quickly to move the patient out of harm's way. In all situations, it is necessary for the first responder to understand which would be the best means of lifting the patient, how to use the device chosen to remove the patient to the ambulance, and how to use good body mechanics to minimize the potential injury to themselves or their partners. In this video, we will discuss the type of lifts and moves, as well as tips to help you safely lift and move your patient. First, it is essential that the first responder understand body mechanics. Body mechanics is the proper use of the body to prevent injury and to facilitate lifting and moving of the patient. Prior to lifting any object, consider the following: the patient's weight. Will additional assistance be required? What are the physical lifting abilities of you and your partner? Plan how you will accomplish the lift and communicate it. Another important aspect of body mechanics involves following a few simple rules when lifting. Position your feet on a firm surface and shoulder width apart. Use your legs, not your back, to lift. Do not lean over and compensate when lifting with only one hand. Keep the weight as close to your body as possible. Rather than carrying a stretcher or Reeves downstairs, use a stair chair. First responders can be prone to injury when they are placed in a position where they are reaching, pushing, or pulling. To prevent injury when reaching, the first responder should keep your back in a locked-in position. Avoid twisting while reaching. Avoid reaching more than 20 inches in front of you. Avoid a prolonged reach when a strenuous effort is necessary. When pushing or pulling, the first responder should try to push rather than pull when practical. Keep your back in a locked-in position. Keep the line of the pull through the center of your body by bending your knees. Keep the weight close to your body. Avoid pushing or pulling overhead. Keep your elbows bent and arms close to your sides. To prevent injury when lifting patients, the first responder should try to use the power lift and the power grip. The power lift involves squatting rather than bending at the waist and keeping the weight as close to you as possible. The power grip involves using as much of the area surface of your hands and palms as possible. All fingers should be bent at the same angle. The palms should be up underneath the object you are lifting, and the two hands should be at least 10 inches apart. There are 3 classifications of moves: emergency moves, urgent moves, non-urgent moves. An emergency move is done as fast as possible with little regard for spinal integrity. An example would be a patient where the car is on fire and the patient needs to be immediately removed. An urgent move needs to happen very quickly, but there is time to be cautious and not aggravate a potential spine injury. An example would be the rapid extrication technique used for the critical trauma patient found in a seated position in an automobile. A non-urgent move is used for the majority of moves, and it is used for patients when there is no immediate threat to life or limb. Usually, the patient is assessed and managed prior to the movement, as is the case of assisting a cardiac patient with chest pains onto the stretcher. Let's review the steps for a number of lifts used in the field. A one rescuer assist can be used to move the patient into a safer area. Place the patient's arm around your neck. Grasp the patient's hand in your hand. Place your other arm around your patient's waist. Then help the patient walk to safety, communicating with him or her about obstacles or uneven terrain. The two rescuer assist is done in the following manner. Each first responder stands at one side of the patient. Each places a patient's arm around his or her shoulder and grips the patient's hand. And then both the first responders help the patient walk to safety. The direct ground lift is often used to move a patient to the stretcher. To accomplish this, the following steps are taken. Set the stretcher in the lowest position and place it opposite the patient. Both the first responders get in position along one side of the patient. First responder number 1 is at the head end, and first responder number 2 is at the foot end. First responder number 1 will cradle the patient's head and neck by sliding one arm under the neck to grasp the shoulder. The other arm should be placed under the patient's lower back. First responder number 2 will now slide one arm under the patient's knees and the other under the patient's back, above the buttocks. If there is a third rescuer available, have them place both arms under the patient's waist, while first responders 1 and 2 slide their arms up to the mid-back or down to the buttocks. On a signal, the crew lifts the patient to their knees, stands and carries the patient to the stretcher, drop to one knee, and roll forward to place the patient onto the mattress. There are a number of emergency moves that can be used by a single first responder to quickly move a non-spinal injured patient. To do the firefighter's drag, take the following steps. Place the patient in the supine position. Tie the patient's hands together with something that will not cut into the skin. Straddle the patient using his or her head. Crouch and pass your head through the patient's trussed arms and then raise your body to raise the patient's head, neck, and upper trunk. Crawl on your hands and knees, dragging the patient and keeping the patient's head low to the ground. A blanket can be used for a blanket drag. Gather half of the blanket up against the patient's side. Roll the patient towards your knees. Gently roll the patient onto the blanket. Roll up the blanket by the patient's head, neck, and shoulders, and drag this rolled material, keeping the patient's head as low to the ground as possible. The last emergency lift we will review is the firefighter's carry. Place your toes against the patient's toes and pull the patient towards you. Bend at the waist and flex your knees. Duck down and pull the patient across your shoulder, keeping hold of one of their wrists. Use your free arm to reach between the patient's legs and grasp their thigh. Let the weight of the patient fall onto your shoulders. Next, stand up, transferring your grip on the patient's thigh to their wrist.